and reason why regenerative therapy is good is because a lot of people tell me that it helps with their pain. If you can get people's pain controlled or get rid of the inflammation, they tend to can get over that process of getting back quicker. Does that make sense?
Right.
Because when you work out and you do the things you need to do and you move, you create blood flow to that area, which helps the healing process.
Right.
So it's very interesting, and we know science has shown that there are some there are receptors, and there's different type of things that the stem cells release or that help bind to some of the pain receptors that are very similar to the opioid receptors. And so that sometimes we can have almost an analgesic effect in saying, wow, you know, my pain's better, Dr. Elamine, or I'm not having that pain I had before. So I feel like I can move better. And it decreases the inflammation. And so a lot of times you have to slow them down and tell them not to do too much too quickly because you don't want them to re-injure themselves.
Right. So it's fair to say that when somebody is injected of stem cell, those stem cells goes and repair the bad part of the injured part of their body?
Absolutely. That's called, and interesting, that's called the paracrine effect. Paracrine, and I'm going too deep on this, but the paracrine effect is like a stem cell basically comes up, a young stem cell comes up to a cell that's damaged and says, hey, you don't look so good. You know, your DNA looks a little old, your RNA looks a little old, you're this, you're that. And what it does an exchange. It says, well, let me give you some of my good things. Let me give you some signaling molecules. Let me give you some things to sort of kind of help you feel better. You know, it's almost like I describe it as if, and I explain it to my patients, imagine you being hungry and starving, and someone comes to you and says, hey, I'm going to give you a nice meal. And you eat that meal, and you feel so much better. You have energy. You feel like, oh my God, that feeling that I had prior to where I was almost starving is gone. That's exactly how that interaction happens. That's what goes on. It not only does that, so it does DNA and RNA exchange. It helps, and then it also recruits other stem cells in your body to come hang out and to join in the healing process. It creates growth factors that create new blood flow, and then also create these things called cytokines, which block the inflammation, and it reverses the process.
Right.
It's almost, when you really study it and you really understand its advantage and what it does, you're just saying, wow, God just created the perfect soldier or to help you heal or product. It's amazing.
Yeah, it is amazing. Now my question to you is, how many types of stem cells are there?
Oh man, there are tons. I'm not gonna lie to you. I mean, I think there's more than we even know. We had my earlier work was with a company by the name of Vivex, and we created this stem cell called the Miami stem cell. And believe it or not, this is like one of the, like, if you look at like the population of stem cells, you have different, like you said, you have different ranks. And this is sort of kind of the purest of the pure, but it's a very low concentration. This studies from that group show that this particular cell had the ability to go, it actually crossed the blood-brain barrier, had the ability to go fight against tumors, had the ability to go do all these amazing things. But the problem with that was it was only a small subset of population. And the place in which it could be harvested was only from selectively either from the upper vertebral body, the vertebrae, or bone from the ribs. Very interesting. I mean, so one of the things that we had a problem with that was producing enough of it, because, you know, you can't manipulate them, you can't change them, because if you do that, then the FDA says you're playing with stem cells, you're changing it, you can introduce a virus or something else that we don't need. So we couldn't get enough of it. So we know that there's multiple subpopulations out there, but we do know that that to answer your question honestly, I don't think we really all know how many out there, but we do know they have certain characteristics that are helpful.
Good. Next question is, what are the diseases that can be treated with the stem cell?
Wow. Now this is my spec. I'm going to just talk about speculations because, again, as you know, excuse me, the people don't realize that the number one use of stem cells that people have been using has been to fight cancer.
Yes.
What do you think a bone marrow transplant is when you have leukemia? When someone gets bone marrow is you're transferring the bone progenitor cells, the cells that make the marrow. A lot of those are stem cellular type cells. Does that make sense, Sekou? So,
right.
When you get a bone marrow transplant, literally what you're doing is you are transferring stem cells and their precursors to actually regenerate the hematopoietic or the blood system in an individual that has that cancer. That's the first thing. There have been studies that have shown that it's been very helpful in like ligament and tendon injuries. Some people are using them to fight diabetes. Some people are using them to help with COPD. Some people are using it with lung issues. But again, a lot of these things have not gone through clinical trials. They have not gone through validation and are not FDA approved for these type of situations.
Right.
So, but we're hoping that in the future, as these studies come out more and more and more, you're going to start seeing better and better things happen.
Right. Good. So at one point you said human can produce their own stem cell, but can somebody else donate a stem cell to you?
Yes, you can. Yes, you can. Well, okay. So now let's back up. So one of the things that we're doing which I'm very passionate about and that my research has been going on, and one of the companies that I've helped start, we actually found a way to harvest, stem cells, and the stem cell, we call them regenerative medicine products. Mm-hmm. And I think it's regenerative because it's more than just, and the reason why we use the term regenerative medicine, Sekou, is because it's not just the stem cells that happen, that make a difference. It's all the things that are released. The cells are there, but the cells may lyse and they may release these things called exosomes, and which are these little vacuoles of kind of how I describe them as these little areas that carry the proteins and the RNA and DNA to help you heal. So we know that it's just not the cells. We know it's all the ingredients inside that the cells produce that are part of, that are released, that make a difference. Because you can have individuals that get umbilical cord tissue, which the cells may no longer may not be viable, meaning alive, but their growth, the things that they release, those exosomes or those cytokines and those proteins, can still have that same effect. So one of the things that a lot of companies are doing, and particularly ours, is we're looking at harvesting human allograft tissue, meaning umbilical cord. The umbilical cord has a huge amount of mesenchymal cells. They have a huge amount of growth factors. They have a huge amount of anti-inflammatory markers and things that help you regenerate. So one of the things that we've done is, because what if you're an athlete or you're someone and you don't have time or the opportunity for someone to harvest your own? So sometimes you can use over the counter, or you can use cells that have been tested and tissue that have been tested. And that's important. It has to be tested. It has to be made sure that it's free of all diseases, right? Because you don't want to give somebody a tissue allograft or and it contains hepatitis B, hepatitis C, or Zika or even coronavirus. Not even that, so you want to make sure that you really, really, really tested your material and that you understand that it's safe and it's been goes through what they call the guidelines that we have to say make sure that you're not giving anybody an infection or disease.
Great. This is such an interesting subject. If you're listening, this is Sekou Radio, and today my guest is Dr. Sadiq El-Amin, who specializes in stem cell development and stem cell technology. So we're gonna make this, doctor, if you don't mind, as the first part of our conversations and knowledge and knowing what the stem cell is. We're going to move into the second part where we're going to try to dissect how beneficial is this for sports and athletes of a high level.